Okay, good evening, everyone. Happy Mother's Day, and it's good to have you once again for this virtual town hall. Let's see here. Okay. As always, I want to thank the Lupus Foundation of America, Georgia chapter with Terry Emond for your support, constant resources and direction always being for us. And the Georgia Council for Lupus Education and Awareness with Representative Kim Schofield and Chris Reed, and the Goal Project at Emory University. So since last week, we've had, as a result of relaxing restrictions in the US, it's predicted that by June 1st, the daily death toll, daily, we're talking, may reach as high as 3,000. Kind of get numb to these figures at some point. And it's also projected that up to about 200,000 new cases per day by June 1st. And currently it's about 25,000 a day. We know that many other states are starting to relax their restrictions, like Georgia has already. And there is a medication called remdesivir that showed very early positive or promising results. Extremely early, it could go either way, but it was encouraging enough. And given the fact that there isn't much of an alternative at this point, the FDA approved its use in emergency situations, and hospitals throughout the country are sort of clamoring for it. But it's really for the dire, very sick that are in the intensive care units. But it's good that at least something is starting to show some effect. And this nursing homes continue to be a significant source of infections, and unfortunately, they may account for about half of all US coronavirus deaths. Let that sink in for a little bit. A half, it's a lot. And we know that the economic impact is just starting to sink in. And these numbers also are just so traumatizing. I know many are feeling it. And you can get numb to these as well, but I hope that we don't. Just feel for all those 33.3 million that applied for unemployment, who are not having a job after having one earlier. Okay. So the projected death by August was previously touted with all the major projections to be before the opening up of the states, to be projected around 72,000 in the US by August 4th. So I just want you to remember that by early August, it was previously 72,000, and now it's being projected because of the opening up to be 134,000. So over double, nearly a double in this slide, but there are other projections that are actually even higher than that. And what's really sad amongst all of this, and politics always rears its ugly head, and same thing with the coronavirus, that this whole issue of safety and wearing masks has become political to some degree. And there's a sense in some circles that not wearing a mask is a sign that you're more leaning towards the right, and wearing a mask is for those on the left of the political spectrum. And it really is just too sad that it's come to this, because it really should have nothing to do with politics, but it should be with public health. So I hope that we as a community of people at high risk individuals for infections in general, but also but specifically for corona and complications of any infections, but again specifically corona, that we will just talk to people around us and really get to the bottom of why are you not wearing a mask, and what is the root of this. And we really need to get at it, because this is the last thing we need, is having some outside pressures such that it puts people at risk. this is to give you a sense of the burden that the United States still has in terms of the total cases. And if you see here that the um, the total number of cases of COVID in the Americas, and by that we mean North, Central, and South America. So this entire half of the planet is a total of 1.5 million. And in the United States, we have 1.2 of those 1.5 million. And it's no surprise, just given that, a sense of how the United States continues to be have the highest number of COVID cases worldwide, as well as the number of COVID deaths. So we talked about how certain states are reopening or soon to reopen, and those are the darker colored states, and Ohio right here in the middle is soon to be reopening. But the yellowish states are the ones that are still on significant shutdown, and this kind of approach as a country just doesn't work because people and the virus don't really stick to borders, unfortunately. So the Institute for Health Metrics and Evaluation, the IHME, I've shown some data from it before. It's an independent think tank that does a lot of this, and it's been quoted in a lot of sources about, and its projections really in the United States is that the deaths will have continued to go up, and they're going to be at a relatively high rate for a while. And it may seem to be going down, but it depends on the region too. And the reality is that the virus, the complications from the virus, and deaths from the virus are going to remain regardless of an event, whether it be opening up of a state partially or completely, or any measures that the government does. And so making sense of the numbers that are coming out as it relates to Georgia, the peak was felt to be behind us, or at least the first one. But with the partial reopening of the state, they've actually assessed that the peak will probably come around May 21st. And the total deaths and the infections you see here on this slide. The total number of cases continue to be highest where the population is the densest, and no surprise that it's going to be in the Atlanta metro area. But you also continue to see, number one, still high numbers without even taking into account the relative smaller population in some of the rural counties, especially Southwest Georgia and Dougherty County and the areas around it. But also, you've heard in the news about the cases, especially hitting certain industries like the poultry and the meatpacking industries. And you're getting a sense of some of these outlying counties around the metro area that are more rural and are having a higher burden of some of the more recent cases in the state. So this is, I wanted to show this to you because it gives you a background as to what may be a little disconnect coming from the governor's office and what other public health officials, whether it be at Emory or the national news, have been stating. And the governor's office is really, bottom line is that they're using different numbers. And you'll see here in the morning of May 1st, this is what was on the Georgia Department of Public Health website. And this is the number of deaths over time. Number one, you'll see here it's blue, and you can kind of see the shape of the curve here. In the afternoon of May 1st, the governor's office took over the website basically and used its own numbers. And no one's really sure exactly where the numbers are coming from, but you see in the afternoon that the graph, the figure looks different. It's a different color, and the shape looks different as well. And so that's what they're using now, and DPH and Kathleen Toomey are not directly responsible for these figures, but the point is they're just using different figures and not the ones that the rest of the scientific and medical community use. So anything pointing towards significant drops in what appears to look like here at the bottom figure of deaths and cases coming from the governor's office, I think you have to really take with a grain of salt. The Georgia cases are continuing to go up, and I guess to most of us, it's not a surprise. And May 1st here, we're talking about a total of 24,000, and May 5th, you have 30,000. When you take into account the relative population of the counties, so in other words, if you take into account the smaller numbers of people in rural counties, and you look at numbers per 100,000 people that are infected, you can see that the rates continue to be extremely high in Southwest Georgia and other rural areas. And Atlanta lights up, but it's not as bright as North or Southwest Georgia is. And you see other pockets here and up in the northern part of the state. And then when you look at counties that are doubling rapidly in terms of the total number of cases, you kind of get a sense of some other areas too that are hotspots, if you will, that are getting cases very rapidly. What's also very interesting too is we talked about the disparities in racial burden and how African Americans have borne a lot of COVID complications and deaths, and they continue to do so. But over time recently, you see here the African American rate, which is this top brighter, lighter color. And relative to other race and ethnicities, it seems to be coming down, but it's still high. What I'll also point out though here is this pinkish line right underneath the African American line, and that seems to be overtaking it more recently, is white, but it's not really Caucasian here. They don't separate. They don't have a figure for ethnicity. And for those of you who know how the government tracks race and ethnicity, they're two different groups. Ethnicity is Hispanic and non-Hispanic, and race is white, Black, Asian, Pacific Islander, so forth, American Indian, Alaska Native, and you can be more than one race too. But you can be white, Hispanic, or Black Hispanic. But I think the point here is really this Caucasian line, or the white line, probably represents a significant number of Hispanics that are starting to be hit, especially in the poultry industry and the meatpacking industry, in the rural areas that are really starting to take up the cases recently. So that's certainly a group that we need to keep an eye on here in the state as well as the rest of the country. The trends in Georgia has been that on the left here is May 1st, on the right is May 7th, and as of last week, really the percent of people that are being hospitalized has been relatively flat, which is good. In fact, it's gone down half a tick. The deaths too have remained stable at 4.2%. And so all of that is good. It's relative flattening. It doesn't say that we have overtaken the medical system, but we're going to have to monitor very carefully about what happens in the future, obviously. And relative to the rest of the state, thankfully the death rate is lower in Georgia slightly, 4.2% to 5.9%. Metro Atlanta, most of the big outbreaks, the rapid accumulation of cases, the doubling of cases, those are outside Metro Atlanta. And Metro Atlanta is actually faring, knock on wood, fairly well. It's stabilized, and as you can see here, the curves seem to be going down slightly. The numbers on the right are Emory Healthcare, since I have access to these numbers, and across all of the Emory Healthcare hospitals, you see the COVID positive patients that are hospitalized, and they're down from 161 in late April to 138 in May 7th. And then the second row here are the COVID positive patients in the intensive care unit, and they've pretty much been stable at only, quote unquote, 58, 59 or 60 people. Yeah, I mean, so I guess the takeaway from, why am I doing this? I think one thing that I just want to hammer is that this is a situation that's going to fluctuate, obviously. Relatively, there will be periods of higher cases and there'll be relative periods of lower cases. But the reality is that the cases are going to remain. They're going to continue to happen. This is a virus that's going to remain in the community, spreading around. It is in the world. It'll be around, as far as we know, indefinitely, just like the flu is and the common cold. And so eventually we are going to have better measures to combat it, and hopefully we'll have effective vaccines, which will get us back into reality, or back into former reality, sooner rather than later. But it's going to take a little time, and nothing's going to change anytime soon. So as things ebb and flow, as the news kind of picks up on things and hotspots, and I just want you to take a step back and just take a deep breath and hunker down, and just be really solid with your understanding and how are you going to manage yourself. And we'll keep talking about some of these questions that come up in a minute. But as an individual living with lupus or caring for someone with lupus, this is something that is not going to get any, it's not going to go away. And there'll be little periods that go up and down, but you don't want to get lost in that. And what I said earlier was that whether things are locked down or not, whether the health systems overcome or not, it doesn't change the fact that there's a risk out there and you have to practice safety measures. And that's really the main intent behind all of this, is that none of us lets down our guard, doesn't get complacent, that you need to know that this is a risk that's going to be out there. And we'll continue to underscore the tactics that you need to have and implement every day to protect yourself the best that you can. And that will come up in some of the questions in a minute. I want to transfer over to a different topic slightly. And I do this with the heart of not overly concerning anybody, because I think we're going to hear a lot of stuff coming up in the news as we learn more about the virus, because it's very fascinating, actually. Just because it's a coronavirus in the family with the common cold and the flu that we're used to before, all of these have slightly different features. They have a lot of common features, but there are slight differences that give them different impacts. And there's a lot that we're learning about COVID each and every day and every week. So I want to show you some pictures of some skin findings that they are seeing in some people with COVID. And because there's a lot of overlap between skin features and lupus, and potentially some of these findings, I want to throw them out there for you to be aware. Now, these are relatively uncommon in COVID, so I don't want any of you to overreact, but I want you to be armed with knowledge, and that's what this is for, right? So a lot of things may or may not look like what you have or what your family member or friend may be showing you. But this is where the knowledge will take you to discuss with your physician. But on the clinical side, from a doctor's perspective, we are hearing a lot more about some interesting skin findings that we just didn't expect. So one of these things that has been out in the past week or two is this observation that some people have with COVID um, can have these findings called COVID toes. And you see these red areas right at the tips, and they can be um, a little irritating, not extremely painful, not as painful as they may appear, and they can be often induced by the cold. But these types of lesions are what can be described as pernio or pernio-like lesions. And there is a specific skin um, condition in lupus called lupus pernio that looks essentially like this. So if it's something that you've had for a long time with your lupus off and on, and you're having it again, and the features look very similar to what you're used to, I wouldn't overreact. If you've never had anything like this before and you are developing something like this, there are a lot of other skin conditions that can look somewhat similar to this. So I don't want you to overreact, but it may be something to discuss because it has been seen in about in a fair number of people with COVID, and some people before they develop other symptoms of COVID. So especially if you have symptoms, obviously, if you have fever, upper respiratory symptoms, a cough, sore throat, muscle pains, loss of taste or smell. I mean, the things that we've discussed before and been reading about in COVID, and you shortly thereafter developed something similar to this. I mean, that all seems to fit the COVID picture. But if you're just having your lupus issues or nothing related to what you're reading about in COVID, and you start developing some of these features, then it may be something to discuss with your doctor. Now that testing is becoming a lot more accessible, it's a question that we can put to bed fairly quickly, is to get tested. Like I said, these pernio-like lesions are not uncommon in the extremities, especially the toes. They can be induced by the cold. It's different from Raynaud's, which I know many of you have, that comes and goes quickly with cold and as the fingers and toes warm up. These are different from that. I don't know if you can appreciate that, but they're not the entire digit like you would have for typical Raynaud's. It is cold induced, but not as dramatic as what you would see sometimes in Raynaud's. And it's felt to be an inflammatory response in the skin. And in COVID, we don't really understand exactly what's going on and what the virus is doing to create some of these appearances and these pernio COVID toes. But it is something that the medical community is a lot more attuned to and looking out for. And these things happen more frequently in the toes, but they don't have to happen in just the toes, so they can happen in the fingers as well. And you can see it's not entirely all throughout the finger or the tip of the finger, kind of pink or purplish throughout like you would in Raynaud's, but it's sort of blotchy and a little inflamed in those areas. Oh, and that's a great point about Black people's feet and darker skin color. That's one of the things I've always been sensitive to. This slide deck, and I should have given the credit to this. It's from Dr. Freeman, the name that you'll see here. She's a dermatologist at the Massachusetts General Hospital in Boston. So I wasn't responsible for these, and apparently her patient population is more Caucasian. But yes, I mean, we're very cognizant at Grady and Emory anyway. And something that I've been trying to preach to other medical educators is to have a very diverse set of pictures so that we know what these look like in other populations. So Unfortunately, I think all of these pictures are in more Caucasian populations. Sorry if I think the internet's a little unstable. If you see any of these things, though, you don't necessarily have to treat them. They can be a little irritable. Thankfully, the skin lesion itself is not anything to necessarily worry about. They can often resolve over time. And if you don't have COVID, and this is just something that you have with respect to your lupus, it is something that can be treated with either topical steroids or some other treatments that your doctor can discuss with you. This one looks a little scary, I know. This is a non-specific viral rash, meaning this is a characteristic of a really bad skin eruption that can happen from any viral infection. It's not common, but and if you get this, remember there's still a lot of viruses that are out there. Just because COVID's on the news doesn't mean every other virus is on vacation. So if you do get this, it can be either a virus or a drug rash is kind of what a lot of people think about. I wouldn't overreact necessarily about COVID, but especially in this time, you want to follow up with it. Some of you have urticarial lesions. These are whelps or itchy. They're itchy. They don't blister up like a fluid, but they do swell up, and they're itchy, and it's what we call urticaria. And that's been not a very common manifestation of COVID, but there have been descriptions. So I want you to be aware of that. And some of you out there, especially the ones that have antiphospholipid antibodies, especially in the setting of clotting issues, there's a skin lesion called livido reticularis. It's like a spider web, and it doesn't necessarily hurt, and the skin issue isn't going to harm you in any particular way, but it is a very characteristic skin lesion that can be seen in people with lupus, especially antiphospholipid syndrome. But this is something that's been seen in COVID, especially the ones that are really sick, that have clotting issues. And some of these people have developed antiphospholipid antibodies as well. And this whole connection is still being figured out, but if you do develop something like this, you may want to discuss that with your physician as well. So I hope that was helpful, not frightful. I don't want you to overreact, but I want you to be armed and discuss it with your physician. Okay, going into the questions. Is there, excuse me, is there any information from the US or other countries that shows how lupus patients who have COVID-19 are doing? And I heard there will be a vaccine by September. Is that true? In terms of how lupus patients are doing in general, it's all an ongoing effort. And one of, there are lots of efforts going on actually, which is good. There's a lot of interest in this, and we're accumulating information every day. It's so relatively early. One of the efforts that I talked to you about earlier is this initiative called the Global Rheumatology Alliance. And they have two parts, one where patients can report symptoms, and also one where physicians can report their patients who have rheumatologic conditions. And this is not just lupus, as you can see here, but they've already accumulated 777 cases worldwide of those that are suspected or had COVID with a variety of rheumatologic conditions. And you see out of the 777, 13.5% or 105 individuals have lupus. A lot more with rheumatoid arthritis, and you can see a smattering of other conditions there. One of the very, very early information coming out of that information or that data set was published in a very brief letter in one of our major rheumatology journals, the Annals of Rheumatic Disease. And this is kind of the title of their letter. It says, baseline use of hydroxychloroquine in lupus does not preclude COVID-19 infection and severe COVID-19. Basically, their conclusion out of early information out of this registry was that they were not able to detect a protective effect of Plaquenil or hydroxychloroquine against developing COVID infection. But I will have to say my take on this was still very critical. I think these registries are extremely helpful in the beginning like this, but they're fraught with a lot of what we call biases in the data. You have to think about where the information is coming from. And you know how physicians are, we are very busy, we're distracted. It's hard to get us to do anything outside of certain things, right? I know many of you have wanted to get forms and things like that filled from a lot of doctors, and that's hard enough as it is. Imagine going out of your way and completing a 5 to 10 minute survey online. And so if doctors are going to submit something on a survey, it's probably something that's very impactful and severe. And so these are going to be the more severe cases, and they're going to come from doctors that know about this registry, that are used to giving information, maybe more academic centers, and because those tend to have more severe disease. Again, these may be just more the severe type. I am positive that there are many rheumatology patients that have COVID that are not reported here because they were either not severe enough to get tested, or even knew that they had COVID, or their physician didn't report them, or they didn't report themselves. So, I think this is a good signal for certain things, and may give us an idea of what may be happening. And it's the best that we have so far. But I think down the road, over time, we're going to need to learn a lot more. And on that note, I did mention in the past that we're going to have a Georgia statewide effort. I've had a few meetings with my team in the past couple of weeks, and we're developing a survey statewide to identify everybody with rheumatologic conditions, but with a special focus on lupus, because obviously I'm involved in it. But it's going to be really looking to see the burden of it in our community, in our state, and what's driving some of the issues for us. And so, yes, we want to contribute to a lot of these other efforts worldwide. All this information is good for us to know, but we need the highest relevant information for us, and that will only come from us in our own community, which may or may not be different from all of these others that are contributing to these worldwide efforts. So keep an eye out for that. Now, going back to the Global Rheumatology Alliance, though, just to continue along the lines of why I feel strongly we need to have our own effort, is that, here, when you talk about worldwide effort, I mean, it's still very dominated by certain European countries and certain parts of the US, for that matter, that are not as diverse as our city and state. So you see, it's predominantly Caucasian. Almost 60% of the people that are reported in this registry with COVID or COVID-like symptoms are Caucasian. Only 14.5% are Black. And in terms of the medications, if you're kind of curious, of all these people in here, those that are on hydroxychloroquine or Plaquenil, about a quarter of them. And then you can see the rest of what we call DMARDs, or disease-modifying agents. These are things like azathioprine or Imuran or methotrexate. And then the biologic drugs like Benlysta, belimumab, or Rituxan or rituximab. And then glucocorticoids are prednisone, so about 30% there. And then overall, again, it just speaks to you how these types of registries are going to be the ones that tend to be sicker patients, because those are the ones that really stand out and are really going to drive the doctors to report them to registries like this. Here in this registry, 44% are hospitalized. I don't think that's going to be the case in the rest of the real world, where most of the cases are going to be as an outpatient. And you see 8.75% passed away. So as one who is currently living with lupus slash MCTD, I wake daily wondering how this pandemic has caused one to adjust my lifestyle. And got a few questions here. How will, in my opinion, will this affect the health lifestyle of members of the lupus community? Will lupus members need to adjust or change their current medication because of the COVID-19? And how can a lupus member best protect themselves when they're out in public? Well, I mean, this COVID pandemic has changed everyone's life, and people with lupus are not going to be an exception. And because of the risk of infection and the potential risk of complications from the infection, people with lupus just need to be even more mindful of the protective measures that are out there. So I'll lump A with C for this one to start. And I mentioned last week that the the best protection is what we already know out there. And it doesn't matter whether you're on Cytoxan, rituximab, all of these really relatively stronger medications, or just on Plaquenil. The fact is, if you don't get the virus in you, those other medications won't matter. So the best thing you need to do is to practice social distancing, to wear a mask in public, to stay away from people who have been exposed, wash your hands or use a hand sanitizer frequently when you're outside, and definitely don't touch your hands to your face, especially if you have not washed or sanitized them. I mean, just doing all of those things by themselves will, I mean, that's going to be our new normal for a while. And having lupus just means that you're going to be ever more mindful of what everybody else should be doing. And there may be a lot of people around you that are practicing these things to a lesser degree, to your consternation, but you shouldn't let that cause you too much anxiety, other than you need to maintain your distance from them. But if you have your mask on, if you're not closer than 6 feet from them, and you're not touching your hands to your face and you're sanitizing them, they can have their mask off all they want. I mean, because the virus is not going to be a magnet to you. It's just that if one were to land on you, get into your respiratory system, that's what all these measures are trying to prevent. And you have the power to do that. So just like you've been empowered, and the LFA and so many other people in your support groups, and you yourself have been struggling to do all along, is to show that you have so much control over this. And that's the thing that I hopefully will be emerging out of this period of panic and uncertainty. And to agree, that was understandable because this was all new. We're learning a lot more about it, and we're still learning a lot about it. But what we do know now is we have a sense of what this is and what it's going to be doing in the society. And let that be the news, but don't let that change who you are. You have the power. When you put that mask on, you're just, I mean, you're just saying to the virus. You're saying that I can go out and I can do the things I need to do, but if I practice it safely, and I can live my life, and I can go to the places eventually that I want to go to, if within certain conditions. But I have the power to know what those conditions are, and I have the power to say whether I'm going to be there or not. And I think these things we talk about, the workplace and all of that too, and to a certain degree, you may not feel like you have all the power to change things there, but that's where we need to rise together as a voice, to go through everything that we've gone through before in terms of making sure that the employers are informed, and they give you accommodations that you have every right to have as a person living with lupus. So these are things that, again, everybody's wondering how this is going to change their lives, especially those with lupus. It is the same that we've talked about for so many weeks. And part of the reason, again, that I mentioned so much about the virus in the beginning is just to underscore nothing's going to change really for a while. This is going to be in the public. People are going to be hospitalized. Some of them will pass away, but that really can be just the news to you as long as you practice what you need to practice. And the 3 to 5 things we talked about, okay? Just remember those things: social distancing, masks, hand sanitizing, don't touch your face. So in terms of medications, adjusting the current medication, there is, people have been thinking about this a lot. The American College of Rheumatology, the European Rheumatology Group, and a lot of people, given the information that we know, a lot of smart people have thought about this long and hard. There is no strong and clear evidence to show that just because of the pandemic that's out there, that you need to stop any medication just based on that. So don't be afraid with what you have now, or whatever it may be that you're taking or will be getting. But having said that, there are so many different situations that you do need to talk to your doctor about it. And because there's just so many caveats, and I can't give a blanket statement, and I can give some extremes, which are not common, thankfully, but there are some extremes that where, I think for a particular person and their particular history and the risks that they've had before and the complications that, I can see instances where, and I have had instances where my own patients, I've had that discussion about, probably adjusting medications just based on the fact that COVID is out there, and God forbid if you were to get infected, I just want to be, I think that given the risk and benefits, there are other medications out there. There's another option we can do that would be just as good or reasonably close to maintaining your lupus, but at the same time, minimizing the potential risks that are pretty small, but for that person, I've had some of these discussions. So I think you just need to take that back. I'm sorry I don't have a clear guidance for everybody, but I will say the vast majority of people shouldn't need to be changing any of their medications. And you may have heard things about prednisone or steroids and COVID. You don't need to be changing any of that. There have been stories in the past about ACE inhibitors, which is a type of blood pressure medication where a lot of people with lupus are on it. Lisinopril is a very common medication. You can stay on that, and you should stay on that. The effect of high blood pressure, and that's very commonly used in people with kidney involvement and protein loss. You need to stay on those medications for that. So don't think about anything like that. In the very early town halls, we talked about some early reports about ibuprofen and staying away from that in COVID. That hasn't borne out. So if you're taking ibuprofen, if you're taking lisinopril before and your doctor was fine with it, if you're taking Cytoxan, rituximab, don't change anything based on what you may have read in the internet or your personal fears, but talk about it with your physician. In the vast majority of cases, you don't need to change. Now, if you do get infected, there may need to be some adjustments there. And even then, it's not entirely clear, but for the sake of being safe, to err on the safer side or the more conservative side, there are certain medications that I think most rheumatologists would either reduce the dose of or stop temporarily during the time someone was actively infected and symptomatic. But that's just when you have a positive documented case and not anything ahead of time. How does getting the flu shot affect my chances of getting COVID with a worse outcome? Number one, the flu shot, the previous flu shot that we've been badgering most of you every season to get, the flu shot has no effect on COVID. So even though they're in the same family, they're different. And so the flu shot, the traditional flu shot, and there's going to be another round of flu that's going to go around like every winter. And there's going to be a call for flu shots to be given in a few months. And I still highly recommend, unless there's a clear reason that you shouldn't get one, that you discuss this with your doctor and you get the flu shot. And my suspicion is that there'll be a higher percentage of people getting the flu shot now, especially being sensitized to the COVID, but it's not going to protect you from COVID. There's a caveat here in that this coming fall and winter, it's going to be an interesting period of time. And I mentioned this before, where it's the traditional flu peak season, and COVID is still going to be around in the fall and the winter. So there'll be at least two different types of viruses going around: the COVID virus, the influenza, the common cold, and there are a bunch of other viruses that are not as common that you may not hear about. And when this current pandemic started just a couple months ago, it was at the tail end of the regular flu season. So there were cases in the ICUs at the time where they were culturing those people and not really testing the people outside of the hospital, but they were testing them in the hospital. And there were about, from what I remember, about 15%, 10-15% that had COVID and another viral infection at the same time. And that's because of the timing at that time. I mean, the flu was still around and sort of coming down at the time. But so all this to say is that, if you do, God forbid, get a COVID infection, I mean, to get a flu infection on top of that will certainly increase your symptoms and increase the chance of having complications. So even though the flu shot doesn't do anything for the COVID virus in terms of protection, it does protect you from the flu, and having less of a chance of having one viral infection. And if you were to get COVID or another type of viral infection, reducing the chance of having 2 or 3 at the same time improves your symptoms and the chances of you getting through it okay. So indirectly, all this to say is, you actually can impact your chance of getting a type of a viral infection from influenza, and we should all be doing that. I'm generally staying away. I'm collecting some questions that don't have anything directly related to COVID, and these town halls, for now anyway, we're trying to keep to related issues to lupus as they are connected to COVID in some way. So I just want some of you people to know that when you're throwing some questions out there and I may not get to them, it's either because I don't have time, and if I haven't gotten to them in a while, it's probably because I'm putting them off to the side because they're either too personal, where I just can't make it general enough, or it doesn't have anything directly related to COVID, and that's a little bit beyond the town hall. So for this question, it doesn't seem to have anything directly related to COVID, but I just threw it up here to remind me to kind of mention that for everyone. And there are tons of new medications for both lupus and rheumatoid arthritis in development. I am not part of this study for Gelzalin, but you can go into clinicaltrials.gov and see all the ongoing clinical trials in the country. The Lupus Foundation of America national website has you can go to look up clinical trials and see where people are doing different studies in lupus as well. But at Emory and Grady, we're doing at least 7 or 8 clinical trials with pharmaceuticals, drugs in lupus. We've been doing that since 2006, one of the first in the country, actually. Okay, that's it for this week. And I'm ending as I usually do to remind you of the wonderful resources that the LFA has, especially our Georgia chapter. And Terry does an amazing job as always. And she continues to put up-to-date links in the COVID Resource Center here. Also links to the National Resource Center, and they've been wonderful as well. Keep sending your questions or comments or any other suggestions you have of how we can improve this for you, make it more knowledgeable. Send it by noon on Sunday, and I'll get to them the best that I can. info@lfaga.org. I hope you guys have a great week. Happy Mother's Day to every one of you, all the mothers out there. Thank you so much. Thank you.